Hello, Allison. How are you?
Hi, so great to see you, Brandi. I'm great. I'm so happy to be here today.
Yes. So thank you so much for coming to Women's Digital Health Community. It was just such a wonderful experience meeting you, how we met. We're going to get into all of those things. One of the biggest common topics that I think is running throughout this world is the topic of stress and burnout. And
Yeah.
so we're going to talk a lot about that and how you're making a change in that area. So before we get started, I just want to briefly introduce Dr. Alison Smith. She's a neuroscientist. She's actually more specifically a neurophysiologist, and she has a PhD in neuroscience from the University of Waterloo. And she's the co-founder and chief scientist of Roga Life. It's a wearable. It's a startup device that is really changing the narrative around stress management and burnout. And we'll talk about how she came through and how she developed this device and how she even partnered with Roga to really impact a lot of people. She's got a number of experiences in neuroscience even before that, in brain injury, using EEG and understanding all of the different wavelengths that impact the brain and certainly impact our ability to manage stress, which I think is top of mind for a lot of people these days.
Mhm.
And so with that, Dr. Allison, thank you so much for coming. To begin with, I want you to walk us through your journey with dealing with your own personal stress.
Yeah. I wasn't a person who was always a stressful person. I was never a person who felt anxiety. Prior to contracting a chronic illness, which I'll get into in just a second, I was a person who traveled around this world alone. I used to go hiking in the wilderness alone.
Mhm.
And it's something I never even thought about. And when I met people who were struggling with mental health, I really didn't understand what they were dealing with. And so back in my first year of my PhD, I was a really outdoorsy person, canoeing, camping, everything like that. And I can only assume that during one of these outings, I got bitten by an insect called a tick.
Okay.
And I didn't know that we had ticks here. I'm in Ontario, Canada. I live in Toronto. I had never heard of Lyme disease before.
Mhm.
And so when I became really sick, like to the point where I couldn't leave my house, I was so sick. Um, it didn't even cross my mind that this is what it could be. And nor did it cross the 8 doctors' minds over the course of the initial 5 years. I got trapped in my house for a long time because of it. And it's amazing to me that not a lot of people know about Lyme disease.
I know. It's fascinating. I mean, we were just talking about, like I've come across so many people who've had Lyme disease and their story is very similar. They're going back and forth and they're trying to have this conversation with physicians. The physicians are, doing the best they can. They are, getting tests, getting diagnostic tools, but no one can ever like really pinpoint what it is that can really address some of the signs and symptoms of Lyme disease.
Yeah, and so at the time, the pain, it, all over my skin, it felt like it was burning on fire, and my joints felt very stiff and sore, specifically in the hands and up the spine, and I couldn't stay awake. And so it was really strange to experience that. And for all of the blood vials that were taken out of me, nothing was coming up. But
Yep.
eventually on year 3, I was put into a category called chronic fatigue syndrome.
Okay.
And I was assigned to a specialist. And I was sitting in the specialist's office one day. I'm on year 5 at this point, and I'm overhearing a conversation between 2 women about Lyme disease. And this woman is describing the symptoms. I'm like, that sounds really familiar to me. And so I went into the office to see my physician. I said, can you just test me for that? And she's like, we're not going to find anything. I don't think that we should test for it. And I said, well, let's just do it
Yeah.
and cross one thing off the list. And so we tested, and all 3 tests came back positive. And so she's like, all right, well, this is what you have.
Mm-hmm.
And the interesting thing, the difficult thing at the time is I'm living in Canada, and the standard of care in Canada at that time was 30 days of antibiotics, and that was it. They weren't.
Okay.
So I was told by my physician that I would have to go to the States for treatment. And so my physician is actually in New York. And so I was in treatment for 3.5 years to get rid of the Lyme. But when I contracted Lyme, it got into my central nervous system. And so for the first time in my life, I started experiencing illogical, severe panic and fear, cycling in and out of panic attacks all day long. And after my treatment, and when all of the Lyme symptoms disappeared, I was left with the anxiety disorder.
Okay.
And it was really hard to shift that. It is incredibly hard to deal with.
So walk me through, you mentioned a few things, even in your experience of encountering your physician, advocating for yourself, which is something that I think is starting to become a more popular phrase. But I'm assuming that when you did this was not popular. What things do you think helps contribute to you saying, hey, listen, let's go order this thing?
Yeah, I think it definitely is hard for all of us to stand up for ourselves when we're in a really difficult predicament. Mm-hmm. But I knew from my life, like how it's hard to describe. My life was so big and I was doing so many things. And then all of a sudden it was stopped.
Got it.
And I wanted to be the person that I was so badly that I was willing to just repeatedly, constantly speak up. I was never overly assertive or rude, nothing, just ever present and asking. And obviously I have an advantage because I'm a scientist and I can just go into the literature and, find data on my own and then come back with a stronger argument to a physician. And I know that not everyone has that luxury. But I just knew that there was something going on. This was not in my head. I had been told that this is just psychosomatic and in my head. And I knew that it was so much more.
That's a very common experience that I'm hearing from a lot of women, that when they encounter their clinical, their physician, that they're told in so many words that it's all in your head. So you mentioned that, you were on this, you were on antibiotics, and then you were left with this,
still left with the panic disorder. It was terrible.
Yeah.
And the stigma around it, I was so embarrassed by the prospect of having to speak to a physician about getting on a medication for my mental health.
Right.
I was taking boatloads of medication for the Lyme, but I was not asking for medication to help with the anxiety disorder because I was so embarrassed by it. And I was also not seeing a therapist and talking to somebody about it. I went for many years before I asked. And then I finally asked because you're stuck at home, and I didn't want to be stuck at home anymore. And I started medication. I was on meds for 7 years, but I discovered that they only help a certain percentage. They actually didn't help me to be functional, and they didn't help me to be able to return to full-time work.
Okay.
They only helped me to stop myself from having panic attacks while at home.
Okay.
So I knew I was still searching for a solution.
So you have a doctor now involved, you have medications involved, you're in therapy, but still not getting this.
Still not getting functional.
Right.
Still not getting functional. And I do realize that for the years that I was at home because of Lyme disease, your brain changes when you're sheltering in place for so long, and you're not in this world and interacting with people as much as you used to. Things happen, things change, and your resiliency changes.
Yes.
And so definitely over the years, I had a harder time leaving the house. And there was a stretch of years where I wasn't leaving the house by myself. I always wanted to be with my husband or my mother. But the only way to get past that predicament is to really dig deep. And the only way is to be an advocate for yourself. And I switched my therapist. I found a clinical psychologist that specialized in panic disorders. And I started doing exposure therapy. And so that's where you're exposing yourself to the thing that's going to trigger the anxiety. And for me, it was leaving my house. I remember those early days of just walking down halfway down the street and then returning home. That's all I could do. And eventually it took about 1.5 years for me to build myself back up, but I got a part-time job and then I returned to full-time work. But the only way that I was able to do that was through my own grit in order to do it. I was I was feeling anxious all day long. And so by the time I returned to full-time work, I was working as a neuroscientist and a product lead at a neurotech company in Toronto. And I was speaking at a conference in Silicon Valley, and I was approached by the person who is now my co-founder.
Awesome. Tell me more about that.
Yeah, so he asked to talk to me. He had an idea. He had to talk to a neuroscientist about it. The idea resonated with me because he had an anxiety disorder. I had an anxiety disorder. He had a wearable based on technology that had 30 years of science backed up around it. He wanted to make it more miniature, portable, discreet, something more fashionable. And he had worked at Google for so many years and he had built hardware. And so he needed someone, a neuroscientist, to help him to build this product. And at first, I just wanted to help him in any way I could. And then within 3 months, he's like, you have to start this company with me. And so that's what we did in January of 2020.
Awesome. So where are we now with Roga?
So we launched the product this year in the fall, and I'm wearing the wearable right at the moment. And so people may not have realized that I'm wearing an anti-stress wearable. It looks like I'm wearing like Apple headphones maybe. But I just want to show everyone that it's a really simple headset. Like the ear hook goes over each ear.
Right.
And then we have these electrodes that are placed onto the skin behind each of the ears. And the device itself emits a very specific, gentle, pulsed electrical stimulation that is scientifically shown to reduce stress-related brain activity.
Yes, awesome. And actually, I got one too. And I actually just want to demonstrate for people kind of like how you would put this on. And I think, Alison, the best way to kind of help people understand how this works is just, what would you expect if you were to use something like this?
Well, let me back up just for a second. Let's talk about the stress response. So we operate in this world and we're exposed to different experiences in our environment. And we are hardwired as human beings to have a stress response. That's a fight or flight response. And it's natural. We're supposed to have it. Back, thousands of years ago, we were living in more threatening environment. And there were predators. And so it's great that our body has this ability to prepare itself, to get out of the way if there's something dangerous that can threaten us.
Right.
Now, in a modern context, unfortunately, our stress response is being triggered by everyday occurrences, like maybe a deadline at work, a conversation with a colleague or a family member. These are situations that shouldn't trigger the fight or flight response, but this is what we're dealing with in our modern age. And, usually what you want to do is just ride a roller coaster, have a stress response and then recover, have a stress response and then recover. But right now, with a lot of us, including myself, we were in a predicament that we went into a stress response and we stayed there.
Yeah.
And so if you stay there for long enough, then that's how you end up with an anxiety disorder.
Right.
It's this never-ending stress response where you feel your heart rate go really high, you're sweating, you have cognitive confusion. Sometimes you feel like you're losing your mind. That
Right.
was the most uncomfortable sensation for me.
Mm-hmm.
And your body gets all stiff.
Right.
Yeah, it's very uncomfortable having a stress response.
Oh, so Alison, you bring up a very good point, because oftentimes when we think about the stress response, I think everyone is starting to learn that the stress response causes cortisol changes and all of these things happen. But I'm not sure if people understand that the stress response affects all organs of our body, including our heart. The heart is a really important, it's probably one of the most important organs in our body. And so this chronic, long-standing stress has huge consequences long-term that I'm not sure if people are as aware of. Can you talk a little bit more about that?
Yeah, and not just to like in the moment of a stress response, the high heart rate not only is uncomfortable, but over time, the more your body responds in that way, it has been shown that chronic stress can cause coronary artery disease.
Right.
And correct me if I'm wrong, but I think that's the #1 killer.
Bingo.
In the US and Canada.
Mm-hmm.
It's really important to, you don't want to totally eliminate the stress response. We're not going to do it, and that's not the goal.
Right.
But there has to be some points where we have a state of recovery.
Right.
And building more resiliency so that we're not reacting like we usually do. So from a brain's point of view, we have a stress response based on our perception of what's happening in our life, in our environment. And there's two main areas that I want to point out.
Mm-hmm.
First is the amygdala. These are two very tiny, small almond-shaped structures deep within the brain, and they are the fear center. So if you're feeling anxious or overly stressed or panicked, most likely you're having a lot of activation within your amygdala. If you're having a great deal of rumination or worry, thinking about the future, thinking about the past, wanting to control the present and really worrying about it, that's governed by a network of areas along the center part of your brain called the default mode network. And so what we're trying to do here in any kind of stress practice is to reduce activation in the amygdala and the default mode network so that your body feels as if it's going to go into a recovery phase, and help you to prevent these larger conditions that could happen. And it goes beyond coronary heart disease.
Right. Mm-hmm.
You know, it can, like, having a panic disorder or an anxiety disorder is really difficult to deal with, and it impacts a person's life on all levels. Right.
So true. So true. My other question is just is there, in your knowledge, a difference between a stress response between genders, or does everyone experience stress differently?
I mean, the stress response is the same physiological cascade, but the reason why it is triggered might be different, or its sensitivity level might be different depending upon the person. And so for females, I think just naturally in our culture, we may be more primary caregivers. We may have to devote more of our mind share to thinking about in the future to make sure that the business of the household is all taken care of. And so women might feel a little bit more overwhelmed than their male counterparts in some instances, but the physiological experience of a stress response is the same.
Thank you for that. I'm going to start putting this on because I just kind of want to demonstrate to people kind of like the process of putting it on, and then we'll check in a little bit later to see kind of how this is this has been going. But Alison, while I'm doing this, I want you to kind of share kind of the process by which people, what have been other users' experience with Roga, because I find it interesting that there's a whole world of wearables out here.
Yeah.
And there are so many different theories and techniques that are wonderful. But I really want you to tell people what the process was when you were piloting this, when you were trying to really get it to confirm, that your research, your evidence-based research actually works in this wearable.
Mm-hmm. So I'm going to start off by describing what exactly the wearable is doing. So everyone will see Brandi and I also, we have these electrodes placed behind our ears. And so the device itself, which is really small, I'm just going to show everybody here. I'm just holding it. So it's a really small stimulation device that is plugged into your cell phone for power. And the stimulation is stimulating a peripheral nerve that is sitting behind your ear. And when you stimulate this peripheral nerve, it's called the great auricular nerve. It sends a feedback signal deep within the brain to an area called the thalamus. And this is our red light versus green light area. We have so much sensory information coming in from our world, but most of us are able to have an attention span, and we can focus in on what we need to focus in on, because that's because of our thalamus. Our thalamus is shutting off all of the sensory information that is irrelevant to us at that time and allowing us to pay attention to things that are relevant. And so when we place the Roga wearable behind our ears and we send this feedback signal to the thalamus, it's reducing brain activity within that default mode network. So that's the area where we create worry and rumination. And if you decrease activity in this area, then you reduce worry and rumination and the likelihood of a stress response being triggered. Now, there is a certain amount of brain training needed around this. Mm-hmm. So that's why we ask people who are experiencing moderate to severe stress to use the Roga device once a day for 20 to 60 minutes for the initial 4 weeks. Mm-hmm. And that's repeated exposures to the feedback signal to reduce activation in the default mode network so that the DMN by nature naturally reduces over time on its own. Our users describe their Roga sessions as becoming more resilient. Their reactivity to what normally would make them feel as if they're going to have a stress response become much lower.
Mm-hmm. It's interesting because while as a physician, I understand everything that you're saying, I also would understand if someone would be hesitant to actually believe that stimulation of the great auricular nerve actually, can actually, eliminate or, reduce this feelings of worry. I find it extremely fascinating. I certainly, had a extensive, education on neurophysiology, but certainly not these connections to how the stress response can actually be reduced through something like this.
And so this type of technology has been around for 30 years now. It's the only type of technology that the FDA has cleared for the treatment of anxiety. And at the moment, we don't have medical device clearance for the Roga device, but that's something that we're working toward. We're in the process of getting clearance with the FDA right now. And it's a class 2 medical device. There's 30 years of published clinical data showing how this can help anxiety patients to not have to rely on medication or cognitive behavioral as heavily as they did. I know from my experience, and I mean, most people who have to take medication for an anxiety disorder, you can end up with a whole host of different interesting side effects.
Right.
And also cognitive behavioral therapy for me was $250 an hour.
Mm-hmm.
And you have to do this for weeks and weeks and weeks in order to really learn the technique. And so it's quite expensive. So we wanted to use a technology that is really backed by science, already recognized by the FDA as a medical treatment, and democratize it, make it so affordable and accessible so that people can try it for themselves. Because there are 71 million Americans who have an anxiety issue right now. They're like the problem is just massive.
Yeah, and I think it's growing. I think 71 is underestimating. Those are just reported. I think there's a significant number of people who are not reporting and not aware. I'm glad that you mentioned those who are using therapy as well as medications as a part of their stress management toolbox. Can you offer kind of how Roga might fit into someone who is using those tools, but would like to try something in addition to those tools to actually enhance stress management?
So Roga is an effective tool that everybody can put in their toolbox. You definitely don't have to, it's not contraindicated to do any other treatment or methodology to regulate your stress level. You can use the Roga device if you're on medication or doing cognitive behavioral therapy. And in fact, we definitely need to do some more research around this, but it is an advantage to use the Roga device when you're doing cognitive behavioral therapy or when you're practicing meditation. And it's really difficult to sit in silence and to just be with yourself. A meditation practice does not involve you shutting your whole thought process off, but you have to be able to sit with yourself. And I remember in my darkest moments of an anxiety disorder that's just not possible.
Right.
You don't want to sit and really pay attention to what is happening in your body because it's so incredibly uncomfortable.
Yeah.
If you have a tool that helps you to reduce the stress response without you having to do anything, then that's really helpful. It gets you in a space where you can actually do the work, because dealing with high stress is fine. You'll be able to feel a physical comfort from using the Roga device, but you still have to do work outside of it to understand what is the source of your stress and how are you dealing with it cognitively.
Right, right. So my last question is just around, what would be the best place to start if you are considering trying to manage your stress? You're kind of on the fence, there's this device there, there's this therapy there, there's this medication there. Where do you think is the best place to start if you're struggling with stress right now?
And so I would always say go to what has the most scientific data. And so when someone has moderate to severe stress and they're seeing their physician, they usually have access to medication or cognitive behavioral therapy. Those are definitely the gold standards right at the moment. We created the Roga product because it's steeped in scientific data as well, and shown in clinical data to really be effective for moderate to severe stress as well, and to have a daily meditation practice. And so whatever you're going to choose, I always like to look at it as, what are you going to put in your toolbox?
Right.
Because all of us need our own unique mixture
right.
of a care package. And so I just want to let everybody know that when it comes to Roga, we're targeting not only the physical causes of stress, but also the cognitive causes. So we have the wearable, but we also have an app that's filled with on-demand video content. It's like a course. It's like you're taking a course to learn how to self-regulate your stress and how to communicate with the people in your life, and particularly at work, more effectively. And we also have access to group or one-on-one coaching sessions with one of our coaches. All of our content is built out by certified coaches and psychotherapists We just want to make sure that we're building a tool that is backed up by science, because that's where you want to go. You want to go where the data is actually telling you some solid information.
Yeah, totally. I totally agree. I think that it was very comforting knowing that, hey, listen, this is 30 years worth of science. We're just making it easy to wear, and portable and accessible to a lot of people. Yeah.
We're the first neurotech company to make this wearable small enough to fit in your purse.
Mm-hmm. Yeah. It's definitely awesome. I also, thought about, actually, let me pause here for a second, because I want to make sure we check in. So I'm feeling it underneath this is just strange. I'm feeling it underneath my eye a little bit. This is just weird. I don't even, and I also feel it like in the front of my head. There's like a pressure here. It's not a headache. I definitely feel like there's something here on this side, and it's very subtle.
Mm-hmm.
And it took a while for it to get there. I didn't feel, actually, it's coming off again, but I didn't feel, I don't feel tingling behind my ears.
Yeah.
But I definitely,
so different.
Yeah.
Everyone is so different. And we have an intensity slider on the device, and at its lowest intensity, some of our users feel a tingling on the skin, and they don't want to raise the intensity at all. Others have the intensity all the way at the maximum and don't really feel anything. What's interesting is that in double-blind placebo-controlled studies using similar technology to ours, they always keep the stimulation subsensory. So nobody knows if they're getting the stim or not from an active device or a placebo device. But the active device always pulls through and shows with significant results for anxiety patients. And it's just really interesting that we don't have to feel the stimulation for it to work. It's still allowing the thalamus to reduce activity in the default mode network over time.
That's awesome. Alison, how can we reach you? How can people get access to Roga Life?
Yeah, so they can visit our website, rogalife.com. And if anyone wants to get a hold of me personally, they are more than welcome to send me an email, Alison with 1L at rogalife.com. Always love to hear from people. There's so many of us who have had to deal with severe stress, and it's always a good thing to talk to people who've been through it.
Yeah, thank you so much, Alison. We truly need this, and I truly appreciate, you sharing your talent and investing in something like this. This is so important.
So happy. Thanks so much, Brandi.